And we can only see where the muscle is by ourselves. Why is this patient so important? Because she has the real shoulder joint pain. You wanted to say, ouch, ouch, you want to have surgery, you may have hormonal drug blockage, or you can just make a step. There's less pain? Far less. Well, this is something different, isn't it? You can just take a step and the pain goes away. But you have to understand what happened in the body. Why, when she stands straight, there is pronounced pain, and when she puts down her foot, the pain goes away. Maybe there is something to think about, and this is of the utmost importance. We want to check this patient later, but we want to show why it's so important to assess how the patient is walking. Please put this step forward. Put your foot forward. If the patient tilts their torso when walking, normally they should not tilt their torso. This means that the muscles are engaged on this side, which compensate for some kind of issue. What kind of issue is that? Do you think this is gluteus maximus? This is nothing. Is it a good joint? Let's look at the patient's suffering. Every doctor likes to look at that. Ouch, ouch, ouch. That's right, ouch, ouch. Was it very painful? Yes. But you shrieked so quiet, no one believed you. You should make us really happy with your shrieking. Nothing makes you happier than your neighbor's suffering. You know that. Well, I want to check if the pelvis instability is the reason. I don't know. I stabilized the pelvis artificially instead of her muscles. Are you standing? Yes. Are you standing well? Yes, I am. Okay, let's check it out. The patient is with us. Less pain. Yeah, much less pain. Well, just like there is nothing. She says, you're not pressing in the right place, you're not pressing with the right force, and no problem, just one movement of a hand. We remove the stabilization belt and tap your feet now. And that's enough. Ouch! Ouch! Okay. And this could be seen right away because of how she was walking. Because no normal person, please step your foot forward, will not tilt their body, will not tilt their torso like this when walking. She also has back pain, but she doesn't know about that. Yes, there is back pain. She says it hurts, but I know why I know it hurts. How do you not know? Well, the muscle is shortened. Dear colleagues, am I speaking clearly enough? If a person tilts the body, tilts the torso on the side, the muscle gets shortened, and it should hurt. Why does it hurt? Because the muscle that should be working, that should be engaged, does not get engaged for some reason in this case. Please put this foot backwards. She raises her leg together with the pelvis, just like this. Every time she steps. Well, the patient was prescribed therapeutic walking. She walks 5 kilometers with a pelvic tilt. And here is that neurosurgeon sharpening the knife. Because when you contract the quadratus lumborum on one side, the intervertebral discs on the other side protrude. Yes, that's the way it is. Just look. That's the biomechanics laws, nothing personal. You can see it visually. There is nothing personal about that. She must not walk, no therapeutic walking for her. I want you to understand the absurdity that is happening around us. The patient is told, well, the doctors say, okay, what shall we do? Shall we treat them or shall we let them live? But that's why people are afraid to go to hospitals until it gets the worst. Why does this happen? Because without understanding the cause, the doctors immediately try to remove the clinical manifestations. And the manifestations are the language of pain. And this is the only language in which the body can say something to us. And we remove this ability to speak. We cut off the tongue with anesthetics, with antidepressants, with painkillers. And we hope that it will change by itself, but nothing changes by itself because the brain does not know how the movement happens. She doesn't know how she raises her arm. She only knows that she raises her shoulder and then she raises her arm. And this pain goes away only when she's walking. So the problem is with the step pattern, to which the shoulder responds like this. And we're going to see why this happens. And we need to know why the movement of a leg affects the movement of the shoulder joint, because we know that they're in totally different places, in totally different regions of the body. And the leg is here and the arm is here. And how do they affect each other? How are they connected? We have to know that if we want to help the patient.